Lifeless Girls. It is your girl, Kim, and I am here with another episode for you all today. I am equally excited as I always am. I feel like I always say that every episode, but I am because, like I said, I learn as much as you all learn, and then I just find a lot of joy in bringing y'all this information that, is going to improve our health and wellness, our physical health. And so I am always excited. And today, I am so happy because I have someone who is near and dear to my heart here to share some information with you all. So today on the podcast, y'all, I am thrilled to welcome Dr. Ianta Burks, a dynamic public health educator and the founder of Blackpink Inc. Dr. Burks is passionate about empowering communities with practical health knowledge, focusing on mental health, heart health, stress management, and much more. As the host of the Rhythm Notes of Health podcast, she brings a soulful, relatable, and entertaining approach to educating people about living long, healthy lives. With her extensive experience working with underserved communities, Dr. Burks is a sought-after speaker, frequently appearing on radio and podcasts, as well as leading workshops on topics such as anxiety, nutrition, and work-life balance. Her insights are both impactful and inspiring, and I'm excited to have her here today to share her wisdom with us. So based on all that, y'all see why she's here, right? Welcome, Dr. Bird.
Thank you. Thank you so much. I'm excited to be here and to just help each one of us learn and be better people,
Good. So you have a lot of information and experience in the public health space. So before we get started, I just want to hear from you a little bit about why your passion lies in the work that you do.
Yeah. So I'm a public health educator. You have a lot of in the public health sector, most people know public health to be CDC or perhaps the health department, right? And which the CDC takes care of policies and pretty much on the administration side, right? And for me, as a public health educator, I do a lot of research. I partner with the CDCs, I partner with the hospitals, I partner with medical doctors, and we go in deep about subject matters. And then I bring it to you in a language of layman, if you will, that you can understand, right? No medical jargon, or if there's a medical jargon, I say, hey, it means this. So what I do is I'm the person that relates to the people so they can understand it. That's why I call myself the soul of public health, because I make sure that we understand all things about our health. And with medicine, it's a bit reactive. Something happens, you cut your hand, you injure yourself, or you have really bad headaches, you go to the doctor. Public health is pretty much on the side of prevention. Like, what things can we put in place to keep these things from happening? Or if these things do happen, you have to go to the doctor. How can I now educate myself so that I can do what the doctor is telling me, with the regimen, as well as put some things in place so it won't continue to happen, or to maintain the healthy status that I'm at that point.
I love that you said that what you do is, as a public health educator, you put it in layman's terms, because, going to the doctor is already an intimidating experience. And then you get in there and they are using all this doctor speak, and using all these long words for the illnesses as well as the medication. And so having someone like you to be for a patient to go to, especially if they're given some, bleak diagnoses, and you're able to break it down for them, that's really important work, because hey, people are intimidated and people don't know what that stuff means. They just take, the paperwork or whatever, and they're like, okay, now what? And I think that the more you know, the more empowered that you feel, so that you can advocate for yourself more. So you giving people that additional support, that's really good work.
No, thank you. I think that the doctors tend to say, well, how do you get them to come? I say, first of all, I have no stake in the game other than to help them to understand what is going on with them so that they feel comfortable in going to the doctor. But to the doctor's defense, they didn't go to school to be an educator, right? They went to treat, right? There's a problem, let me treat, let me fix. And sometimes you run across doctors who do have the ability to help you understand. But what I say to everyone is what every person should be afforded from their physician, a medical doctor, is to take the time to explain to them, right? And I even go to the doctor sometimes, and if they don't know I'm Dr. Burks in public health, I don't say it, right? And sometimes they rush me, and I always say, well, if you could just, you can have a seat because I have some questions, right? And sometimes they do, and sometimes they're intimidated by me. And so I always say that every doctor that you encounter may not be a good fit for you. And that's for you to decide, does this doctor treat well, but also do they help me understand what's going on with me? But I'll say this at the beginning, I'll say this at the ending. I have an email address. When you go to the doctor, if you're not clear, you can give me a call. I help you to understand. And it's info at blackpink.org. I will get your questions answered. If I don't know it, I have a panel advisory team of 12 doctors, and I reach out in different genres, or different areas of medicine. I reach out to them if I don't know the answer and get the answer from them and get it back to you. So I like to afford that information to everyone to say, you can always reach out to me to get the information that you need or help you understand something that's going on with you, or if you have questions about yourself.
A great resource. Yeah, I'll make sure that I post that so y'all can see it as well. So my first question is, you talked about how public health is about taking preventative measures. And that seems to be something that is not a strength in the Black community. And in your experience, why have you found that we don't prioritize preventative care?
Yeah. Well, because we have been intimidated for years, right? About preventive care. And it's not in our face. What's in our face is if you get sick, you go to the doctor, right? And so it's not in front of us. We don't see it. And so we don't know it's there. You'll be surprised how many people don't know that, hey, I need to get some information for myself. We Google things, or I call those the Google patients. And, you Google things, and not everything that you Google is reputable, right? Unless you go to a reputable source or go to some papers that have been researched and they have references where that information is. I wouldn't go to Google, right? It can give you an overview. It can scare you. It can have you crazy. But I think mainly it's because it's not in front of us, right? I call myself the soul of public health because everyone wants me to come and speak, because it's not a lot of people it's some people who speak. And I think some people get it wrong. They'll ask doctors to be on panels, and which is good, but I think they should always have a public health educator on the panel as well to help people to understand. Because I'll tell the doctor, like, they don't know what you're saying. Like, I'll say that if I'm on the panel with them, and then they'll say, oh, okay. And I'll say what they mean is, so to answer your question, I think mainly it's because people don't see the public health person in front of them, and they don't even really know that we exist. You're gonna see that your audience is gonna be like, oh, I didn't even know that this person exists to help me to educate, right? And then I don't think that some people are just not relatable, and so it's like, I don't want to hear that. What are you talking about? So it is, I went to school just to learn how to educate you in a way that you were going to receive it based on your background, based on where you came from. So I love what I do because I like empowering people. And I always say that you're 24 hours with your body. The doctor is 30 minutes, 10 minutes, an hour, probably not with you. So you know more about yourself than the medical profession. And that's why it always should be a partnership with you and the doctor. It just shouldn't be the doctor said this. It should be like, how are you feeling and what are you doing and what have you noticed? So it should always be a partnership between the patient and the doctor for a healthy outcome of whatever you have going on, or preventive.
So if you're speaking to a woman and she's like, okay, I have not been to the doctor in 5 years since I had my last baby. Okay, where should I start? What do I need to make sure that I do to start taking charge of my health and taking these preventative measures?
Well, the first thing I'm going to say is you're going to get a spanking. You haven't been to the doctor. You had to have the baby. You had to take the baby to the doctor. So at some point you should have gone. And once I get past that, because that's just going to help them to relax. Like, you haven't been to the doctor, you're going to get a spanking, right? But once I get them to relax, what I normally do is say, well, the first thing that you should do is have a physical, right? Because physicals are very important, because the doctor is going to bring you into the office and check you basically from head to toe. They're going to check your blood work. They're going to send it off to the lab. They're going to check your blood pressure, right, to see where your blood pressure is. And so I would say the first thing that they should do is have a physical, right? And if from that physical, women, for me, what I tell women, women should also have an OBGYN or just a GYN if you're past, having babies. But you should have an OBGYN because although your internist or your family doctor is going to check you for everything in your physical, I like people who have expertise, right? Because what the internist or the family care doctor see and the OBGYN see, the OBGYN is going to know specifically, oh, this is this, this is this, this is this. So I tell women to have a physical, right? But I also tell them to have your annuals, what we call them, with your OBGYN, which is your annual pap smear, right? And then in your physical, the doctor will sometimes, do breast exams. But again, the OBGYN has this specialty. They've gone to school a little bit longer. And so I like to go to people who specialize in the areas that we need to be in, right? So I would say first to go to your doctor and get a physical done, right? And then after that, I would schedule your GYN because then the GYN is going to get your mammogram done, all of those things if you're of the age to get your mammogram, and they're going to test your hormone levels and all of those things. So I do think it's very important to first go to your doctor and get the physical and also schedule for your annual exam.
What are some of the most common diseases or illnesses that really seem to be plaguing Black women right now in 2025?
That is a very, very good question. So the number one killer of Black women is heart disease, right? And so when we talk about heart disease, we're talking about your blood pressure. We're talking about stress, which most of us are under, right? But heart disease, we're talking about your cholesterol, diabetes, all of those things that affect your blood flowing through, which is your heart. So heart disease is the number one killer of Black women. We hear a lot of people say, oh, they had breast cancer, they passed, and or maybe they had ovarian cancer, they passed, and maybe they had lung cancer, they passed. But the number one killer of Black women is heart disease. So with that, it is important that we understand to know our stats. And when I say that, I mean, know what your blood pressure numbers are, right? Anyone who has hypertension should have a blood pressure cup at home. And you should at least take that blood pressure once a week. Don't freak out. Take it at the same time. If it's going to be in the morning, I'm going to take it in the morning. If it's going to be at night, I'm going to take it at night. It shouldn't be in midday because your blood pressure fluctuates, right? And I have the blood pressure cup that actually records with an app. We're so savvy with our electronics. There's an app that goes with the blood pressure cup that records my blood pressure. So when I go to the doctor, I can say, here's what my blood pressure numbers have been looking like since I've last seen you, right? So it is important that Black women understand that heart disease is the number one killer and put things in place so that we can, first of all, know that will potentially have a heart disease problem, right? And then start the process of, moving, right? Handling your stressors. I get up every morning and before I start my day, I get in the shower and I do yoga. That's what I do. I'm meditating. It's helping my movement. As we get older, it's important that we make sure these joints are moving. So it helps with my movement and my stretching. That's how I start my day. Now, sometime in the day, now that it's getting warm, I'm going to go play tennis. So I'm going to have some additional activities. You have to be intentional about doing these things. Settling your stresses down, breathing. You see, I have this bracelet that take 5 deep breaths 5 times a day. And the reason that that's important, the reason that I give them away when I'm at events, and I always talk about it, is because sometimes we're holding our breath and we don't even realize it, right? And then sometimes we're breathing fast. So if we've been intentional about 5 times a day, taking breaths through your nose and out your mouth, it really settles you down. And every time I do this activity, I start out really excited. And by the time I've gotten to 5, my voice has lowered down because it has calmed me down as well. It is very important for women to put things in place to know their stats, by going to the doctor, knowing your blood pressure, knowing your cholesterol levels, right? And if you're diabetic, taking medication if you can't control it naturally, right? That's important because, you will say, well, my grandmother did blah, 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 blah. And perhaps that works, but I would say that if you're at a point where you have to go to the doctor, I would say take the medication and partner with the doctor so that you can have a balance, because we want you here on earth and we don't want you to have kidney failure, right? And all of those things. So it's important to just know what your stats is by going to the doctor and then partnering with the doctor and putting things in place. So for movement and to bring your stress levels down.
So I think a lot of people, we hear a lot about a lot of diseases, and I think it's easier for us to understand diseases that you catch or something like, even though cancer is a bit more mysterious, we kind of understand like people get cancer. But can you speak to like, so is heart disease, is it hereditary or is it solely based on how you eat? Like, talk to us a little bit more about how one might find themselves being diagnosed with heart disease.
Yes. So that's a very good question. I often tell everyone that, yes, it can be hereditary. Let me just tell you about what I mean when I say can be, because you can find things in your heart that, okay, my grandmother had this and that grandmother had this. And so it's passed on, or my father's side had this. But here's the thing. I tell people that things lie dormant inside of your body, inside of your bloodstream, inside of your mitochondria, right? But they don't necessarily have to come to the surface and be like, oh, it's hereditary, it's going to happen. But really and truly what that means is that if someone in your family did have this dis-ease, is what I call it, then your chances of having the same dis-ease is higher, right? But if you are aware that someone in your family had this dis-ease, now you can say that, hey, listen, my family had this problem. So what I need to do is make sure I'm checking my blood pressure, right? Make sure I'm checking my cholesterol levels. Make sure that I'm managing my stress. Make sure that listen, this is what I do. I do one thing a week if I do nothing else. Every Wednesday night is selling night. So if I don't eat healthy no other night, I'm eating healthy on Wednesday night. So the reason I tell people that is because it's like, make changes, right? But I'm a very conscious eater. I tell people that I'm a conscious eater. And what I mean when I say that is that when I eat, if what I'm eating agrees with my mental, then I'm enjoying my food, right? If I'm eating bad, it's not enjoying. It's not. And I'll say that, we were hanging out recently and you see, I didn't get fries because I had just had fries 2 days ago. So I'm conscious, I'm intentional that I just had fries 2 days ago. I'm not getting fries. I'm just going to eat the chicken, right? Or sometimes I get a salad on the side. So I am a conscious eater. I'm intentional about my eating because I always say I'm going to live to be 102. So if I'm going to live to be 102, what things am I going to put in place to make sure that these things happen for me, right? So that's important. And we didn't talk about vitamins and minerals. When you met me, you guys are calling me the vitamin D doctor. So I'm a big proponent of vitamin D, making sure that you have enough, making sure that your doctor is checking your vitamin D levels. And recently I did research with magnesium. And so now I'm this really big proponent of magnesium. It actually helps to dilate your blood vessels where your blood can flow through. So it is known to help with your blood pressure and your diabetes level, right? And there are several different types of magnesium that you need. I have acid reflux, right? Guess what? I have not taken any acid reflux medicine in probably about 6 months now because I take my magnesium, right? And what I want to tell people about the magnesium, since we're talking about it, and the vitamin D, is that when you take these vitamins and these minerals, your body has to have something to get inside the cell. Otherwise, if I just take magnesium and just go to the bathroom and poop it out, but I got to take a multivitamin because I need that vitamin C to get it inside my cells. Otherwise, it's going to be like, people are going to be like, I was taking that magnesium, wasn't doing nothing for me. Well, you wasn't taking your multivitamin, right? So we all should be taking, especially if we're over 50 or over 45, but we all should be taking a multivitamin. We all should be taking a vitamin D, and we all should be taking a magnesium. And I tell people to take your magnesium at night because it helps relax you, puts you in a deeper sleep. So those are the things that we need to make sure that we're putting in place and that we're doing to help if these things that's dormant in your body, right, to let them stay dormant. Because if you give them a somewhere to come out, then they're coming out. And we can't eat like our parents did back in the day because the food is different, right? The environment is different, right? Our stressors are more, right? So we cannot do what our grandparents did or our great grandparents did. We can't eat the same. and we can't overcook our food. Because I tell everyone, if you're overcooking your foods, where they're mushy, you're getting no vitamins and no minerals. So I would say, yes, you can, things are hereditary, things like dormant in your body, but they don't necessarily have to take legs and take car and wheels and drive, right? You can
Mm-hmm.
drive them and keep them dormant. But if it does, running your family, know that your chances are greater to having this dis-ease in your body. So be conscious and be intentional about keeping those things dormant in your body.
Something right. I take all of those that you mentioned. So yay
Very
me.
good. Very good. Very good. Very good. Very good.
So, other than heart disease and diabetes, is there anything else that you're seeing that the numbers are troubling as far as the African American or Black female population goes?
The vitamin D levels. Most of us, again, I've been talking about, I did breast cancer research in graduate school. And what we found is in this research is that if if you look at a cell, the cell is round. When you look at the outside of a cell, the what's skin on the outside of the cell is smooth, right? And so what we found is that when we injected that cell with cancer cells, if the outside of the cells was smooth, the cancer cells kind of bounced off. But if the cell was deficient of things, vitamin D, then it was rigid, meaning it wasn't smooth, it had little bumps, the little heels on it, right? And if that was the case, if you think of a ziggy line, it's kind of goes, like waves, if you will. So if the outside of the cell looked like waves with ridges, then the cancer cell was able to go in there because now it was deficient of vitamin D. And so what we concluded was is that if your cells have deficiencies of vitamin D, right, and specifically D3, because that's what you get from the sun, then it actually helped to protect you from cancer, right? And I say, and why does everybody tell us that? Why don't they talk about that? Why don't they? So so it's very important that you take your vitamin D. And so those numbers are staggering. Most Black people are deficient in vitamin D. It really doesn't matter how much sun you get. And then the darker your skin is, like me, I play tennis, I'm not in tennis, but I still take a supplement for vitamin D, right? Because I'm just not, we're probably going to burn before we get enough vitamin D that we need. And you need the vitamin D from the sun. And it helps when you're outside because it's going to help absorb, what you have in your body. But you got to take that because if you're irritable, if you're not sleeping, and if you find yourself being sick often, you're probably vitamin D deficient. So those numbers they still don't look good. But I do find that more women are more conscious of it, and more doctors are now starting to just automatically check you for your vitamin D deficiency. And it is important to me that if you look like me, you really understand, as a physician, you really understand my needs, right? So I always tell women to, get a doctor that looks like you, who understands you, not just dermatology, but just in general, who knows that, okay, Afro descendants, and you'll hear me say that, and I mean Black people who descended genetically from Africa. So I'll say Afro descendants, you'll see that we need things differently than our white counterparts. So it's important that we have a doctor who looks like us, who understands us better, and because they have stake in the game, because they look like us, right? So that's important to have. So vitamin D, so your vitamin D levels, right? Those cancer, the hypertension, and then getting those mammograms or doing the self-check exams. It is very, very important that, remember I said you're with your body 24 hours. And so once a month, you can be in the shower, wherever. You should be touching your breast. So, because people say to me, well, what are you looking for? What are you looking for? This is not what you're looking for. It's what do my breasts feel like every month? And then one month I feel them and, oh, I haven't felt this, right? So what you're looking for is what you wasn't feeling before, something new, something different. So, and the only way that you're able to measure this is to do it monthly so that you get used to how your breasts feel. Some people breasts are lumpy. They're just naturally lumpy, right? And so if you touch like, oh, there's a lump, don't freak out. Keep checking it every month. If it's something that really sticks out, go and let your doctor, have a look at it. And get off Google and get your mammograms done because they save lives, right?
So I'm glad you brought up breast checks and mammograms. A lot of people are terrified of mammograms. They found a lump in my breast. I can't even remember which one it was at this point, but they were monitoring it for like 2 years. I was going every 6 months for 2 years, and they were just watching it, and making sure it wasn't growing or changing anything. So I've had quite a few mammograms, even though I haven't been 40 that long. For me, the hype that people talked it up to be, it wasn't that bad for me. I'm a breastier girl, and hey, I breastfed a baby, and I don't think anything could be worse than that because it feels like a Wolverine on you. So
Yeah.
maybe I'm a little desensitized. But can you just talk to those people about what a mammogram experience would be like, and those people who have that fear of even scheduling an appointment because they think it's going to be so painful?
Yeah, yeah. So I had to, on my podcast, it's kind of, sometimes it could be, I can say things that, so I have to think
Hey,
about,
keep it
your
real.
podcast audience. So,
No, you can say it.
so here's the thing. So you go, that mammogram in that 5 minutes on each breast, and, is nothing compared to saving, you're potentially saving your life, right? And we do a lot of things that's discomforting. We're involved in a lot of things, but if we're going to, it's not even as bad as a headache because it's quick.
Or bikini wax. A bikini wax is much worse.
It's that part. It's horrible. It is it's like you go and it's like, I don't even know why I go, and then you go again, right? So, and you don't even have to do that with a mammogram. You normally got to do just once a year, right? For standard. So I would say, when you go, and this is really, I've had mayors of city that I've gone to, and I've spoken at an event, and I have to sometimes, hold their hands as I'll go with you, or you call me there. And then they'll be like, oh, it was nothing. I thought it was going to be so bad. So I think that it's just a rumor of what people say that you think is going to be bad, but really and truly you go and you expose your breast, and they take each breast, and what they're doing is taking a picture to look at the tissues inside of your breast, right? And so what they do is take each breast and they kind of put it on this little, I'd say maybe something like a pan. That I'm saying that because it's a flat surface. Let's say a flat surface. They put on a flat surface, and then they kind of bring the top down and they press it down because they want to be able to see really good what's in there. And it's like, hold your breath, and it's like 1, 2, 3, 4, 5, and it's over, right? And then they may want to do another angle. Hold your breath. It's 1, 2, 3, 4, 5. It's over. And then they do the other breast. So this is something that could potentially save your life, because if you have breast cancer, then you can potentially die. And you will be like, I should have had that mammogram. I have people that say I don't get mammograms. And you know what I have to say? Now, it drives me bonkers as a public health educator, but you know what I have to say? Well, this is the choice that you're making on your life. So if you get breast cancer, not saying that you're going to get it, but if you get breast cancer and it's at a stage that is gone, now you can't go back at this point, right? And now it's too late. And so now I guess you just have to say, okay, well, I'm good with where I'm at. And if I don't make it, I have to be good with that too. That's all I say to them. I say, you clear that if you get cancer and it's at a later stage, right? Because the goal of getting these mammograms is to catch these cancers at an early stage where they are treatable for you and not causing as much as havoc over your body as they can. And that's why you need to check your breast, monthly also, just so you'll know what's going on with your breast. So it's not a horrible procedure. Like you said, that was perfect. You said it better than me. The waxings are way worse than getting the mammograms done. But if you need to take someone with you, take someone with you. And I also tell women that if you need to have a medical partner or a mammogram partner, you have someone who holds you accountable. It's like me and my friends, it'd be like, I got my mammogram done, check. We literally tell each other, like, I had to go get my mammogram done today. And, like me, had fibrocystic breast at one time. I was like, oh my gosh, I'm not going to do this around my birthday. The breast may have these little fatty tissues in here. And So, but the more I learned about that and in Black women, the more I became comfortable. If it's that, it's nothing, right? It's just something that they want to watch. And because we sometimes can have these fatty tissues as Afro descendants. So I would say get a buddy. And if you need that buddy to go with you to get the mammogram, take someone with you. They can't go in there with the mammogram, but they can walk you all the way to the end. But they ain't going in the room with you to get the waxing. So thank you for helping me with the waxing part. So I would say it's a quick procedure. It doesn't last long. And, to me, wearing lashes is uncomfortable. It makes my eyelids heavy. And, my daughter and my cousin say, don't put these lashes on your face because it's like, it's too much. So I'm saying that those are discomforts that women do, right? That for cosmetics reason, you want to look good, you're going to do these things. And I'm saying this preventive measure that you can take with getting this mammogram is nothing. It's nothing. And it doesn't last long. So get your mammograms and do your self exams at home.
Yes. Thank you. Ladies, it is not as bad as people try to make it out to be. I know you all have probably heard all these terrible horror stories. It is not as bad. So if you have not gotten one, please go ahead and schedule an appointment to get one. As Dr. Burks said, we do a lot of things for the sake of vanity and beauty that are much more uncomfortable. Some of it is downright painful, and we still continue to get those things done. And so this is something that you're doing once a year. So even if it's a slight discomfort, it's over quickly and you're not doing it often. So if you can go in there and let them snatch the hairs off your behind, you can go and get a mammogram.
Right. That's right.
When the lady at the nail salon cuts your finger and you bleed and or you get a little nick or something that burns, because those little cuts hurt, you still go back and you continue to get your nails done. So I think that we have to, put our big girl panties on and also stop listening to what other people say, because your experience could be completely different. But
That's
more importantly, like you said, I mean, not to be extreme, but you could end up having to have a mastectomy, have your breast removed. Now that's going to really hurt. So, just putting into perspective, being proactive is always going to be better.
Being proactive. Absolutely. Being proactive.
So I want to talk about, let's venture over into the land of sexual health a little bit. So, most women our age, younger and older, are sexually active. So, first I want to just talk about, safe sex and what women should be doing to protect themselves. And then we'll get into a little bit more fun stuff, maybe like the pleasure side as well.
Yeah. Yeah. So this is important to know that the highest rate of STIs or STDs is in older women. Now, yes, absolutely. Absolutely.
Wow.
Don't take my word for it. Go Google that, right? Is in older women. And I mean 55 and older. And I think mainly because I think we feel like when we're at this age, we're okay to have unprotected sex. A lot of the women in the centers, right? There may not be that many men, and they may be having sex with 3-4 of them in the senior center. These are real fact-based things that are happening, and it really sounds crazy, but it really is happening. And when I meet with the health departments and I talk to them, and they tell me like the highest rate is in seniors, right, of STIs and STDs. Of course, you have the college students who also have a high incidence rate. But I would say that when you meet someone, you should be having protective sex, and you should be having protective oral sex because intercourse is sex, but oral sex is sex as well. And anything that can go inside of your mouth or exchange bodily fluids, then disease can be transferred from one to the other, right? So I think that women should be using protection. They have all types of condoms out here now. They have and then don't wait on a man to have the condoms. If you're out here, you're sexually active, you have your own condoms. Like, okay, here you go. Like, you know what I mean? Don't look for them because perhaps they got condoms, perhaps they old. I don't know. Or perhaps they don't get the feeling that you want when it's used with you. So I would say women, take the time and buy your own condoms, right? You can have your own. Don't rely on men. I tell my daughter that, and she and her friends in college. Don't rely on boys to have condoms. You have your own condoms, right? because I'm a person who I'm public health, so I'm proactive. And so I'm going to be proactive with my daughter and her friends, right? And say, hey, listen, we know we did in college. So if you're going to be doing this, then be responsible, right? Because you don't want to be later on in life, you have something that you can't get rid of, right? So it's important that you have your own condoms and you do use protection until you know that you can trust someone. Some people say, I want to see your STD panel. You go before we go. And I don't think some people really do that, but some people don't do that. But what I'm going to say is to just make sure that you are using protection. And I don't just mean protections from having babies if you're still in this age of having babies. I mean that if you are using protection of condoms to protect yourself from these, because men gonna always say, and women too, as far as they're concerned, nope, I ain't doing it. I was just with somebody last night. You know what I mean? So I would say,
True.
you don't know somebody, you meet people on these apps and what have you, you make sure that you're using some protection because I just told you, look it up. The highest rate of STDs and STIs is in older women. So make sure that you are wrapping it up and don't hold your own power and you wrap it up in that way. You said I'm going on this sexual health side. I talk a lot about sexual health because I think as I'm 57. So as we get older, people think that when you get older that your sex life should be blah because now you're in menopause or perimenopause and, things are you feel differently than so I do a lot with menopause and what we slangly call menopause. So I do a lot with prostate health and a lot with the menopause with women. I get a lot of questions. I have so many people call. I now have a consultant fee to just help educate you about your hormone levels and those things because you still should be having a good, healthy sex life as you get older because guess what? It calms down that stress. It really and truly does. It relaxes you. You may have had a bad attitude and then you have sex with your spouse or your significant other, then you be like, oh, hey, babe. Because we be like, well, I thought she was mad at me. Because now my stress levels are down. And the hormones have, kind of balanced out. And so I'm not necessarily, I'm relaxed now. We know what sex did for us when we were younger. It can do the same thing for you when you're older. You just need to make sure that your hormones are balanced, that, if you're having vaginal dryness, what can you do to not have vaginal dryness? This is not this podcast. On my podcast, you can go, and get the details of these things, or you can reach out to me and I can help manage you with this. Sex should be pleasurable for both people, the male and the female. It should be comfortable for everyone. It shouldn't be discomfort. If any type of discomfort going on, you can reach out to your doctor. If you're more comfortable reaching out to me, you can reach out to me and I can refer you to the doctor and I can tell you, hey, this is what's going on. And again, I have this panel of medical doctors that I partner with if I'm not able to answer your question. But all sex should be pleasurable. There should be lubrications. There should be, as you get older, your vaginal walls, they thin out, right? And then there may be friction and then it may not feel as good. So it's like I really had a guy to tell me at an event about 3 weeks ago, sex is overrated. And I laughed and I said, well, Ludacris said it's overrated if you're not doing it right. So before a guy to say sex is overrated, first of all, what I knew is that his hormones he had depletion in testosterone, right?
Yeah.
And he wasn't having the erection that he would have when he was younger. So he's just knocked it off and sex is overrated. But now I've got him on the track, good track. I educated him. I partnered him with the urologist. And guess what? He said, I'm so glad that you didn't allow me to leave
It's
you
not
with
overrated anymore.
It's not overrated anymore. Right. Absolutely.
So how often should a sexually active woman, no matter the age, be going to have exams done or checking? How often should that happen?
Good question. It still should be your annual. Once a year should be just your annual. But if you're having some type of discharge, then you, of course, should reach out to see your doctor and not try to treat yourself and not think that everything is a yeast infection. One of my highest rated podcasts is a yeast infection. Myself and the doctor who did it with me, we joke about it all the time because she's a OBGYN and she says, yeah, because anytime someone has a discharge, they think it's a yeast infection. It probably is not a yeast infection, right? So if you're having some type of discharge, if it's a milky discharge, it's probably a bacteria infection, but you need to go to the doctor so that the doctor can treat you, because untreated, that it can cause precancerous cells, or if you're still in the phase of having babies, it can cause you to be infertile. So you want to, and then who wants to run around with the infection that they're not comfortable with? We know as women, it's very discomfort to having some type of discharge where you don't feel good, and you don't want to have sex. But go to the doctor, and I promise you, don't be embarrassed to go to the doctors, because they're the doctors and they've seen it all. So you go to the doctor and get yourself checked out so that we can catch things early on. And so we can actually, the earlier you catch things, the easier they are to, kind of maintain, get rid of them, or balance things out.
So you spoke a little bit about sexual pleasure. Can you just speak to, this is so big, I'm trying to figure out how to shrink it down so we don't spend too much time here. So the female body goes through a lot of changes as you age. So when you have a baby, there are changes, and then when you start to move into perimenopause, and of course into menopause. But there are all these different phases. What have you found that women say is the most challenging time for them as far as sexual pleasure goes?
When they start to, have these depletions of the hormones, in which, the perimenopause, is when you start. So menopause, let me just start that. Menopause is the absence of your cycle, right? But you have to get to that. You start with the peri. So with the perimenopause, you start to have sporadic cycles. You may have it 1 month, and 2-3 months go down, you have it again. And so it's kind of sporadic, but you're still starting to lose, the hormones. And so when these things happen, you start to get irritable. You don't want to have sex. You probably don't even like your partner because these hormones are off, right? But I would say once those hormones starts to, let me just put things in perspective. Outside of you have illness, right? If you have some type of illness, of course, sex is going to be the last thing on your mind, right? Except if you have a cold. I tell people, if you have a cold, to have sex, because it boosts your immune systems and help you to get rid of the cold quicker. I've said that for years, and it really and truly, you really should. If you have enough energy to have sex, you should have sex. It's going to help you get on over that cold really and truly quicker. But I think, as you start with this perimenopause, and most women are in denial about this perimenopause and or menopause. I literally just talked to someone on Saturday, and I really don't like to do public health stuff on Saturday, but it was for a friend, and he wanted me to talk to his girlfriend. So I talked to her, and I asked her, was she flashing? Do you have hot flashes, or do you have night sweats? And she emphatically said no, right? But she's in perimenopause, meaning that, again, she's having sporadic times that her cycle is coming on. And so I asked her those questions, and she said no, she don't have any hot flashes. She don't have any night sweats. And so I said, do you drink red wine or do you drink vodka? And she said she did. And I said, so which one do you drink the most? And she said the red wines. I said, so when you drink red wine, do you sometimes feel really, really a rushness of warmth, hot? And she said, yeah, I do all the time. And so, okay, well, then you're flashing, right? So I have to ask questions in different ways for people to understand that this is what you're going through, right? So they can understand that you do have these hormones that are starting to deplete. And so that's when you first start to say, I don't really want to have this sex. And, sidebar, I have men who come to me and say, get my wife, I want my wife to have a sex like we had before, get her back, talk to her about hormones, talk to her about the things, the replacements that you need, help her. And then I help the wife, and then they balance out their hormones. Now they want sex all the time. Now the men coming back to me is like, I didn't want her to have sex. So it's like, wait, what? Don't you say? They want him. Now they need to be balanced, right? So everybody need to be balanced with their hormones so we can have a perfect union, right? But I really and truly have some men coming back to me, they upset. Got my wife doing these balancing out these hormones now, and now she's wanting sex all the time, and now they want to sit in front of the TV. I was like, well, because you need your hormones balanced as well. So I kind of on the backside, I get beat up by the men. The front side they want help, and then on the backside, it's like, oh, no, they doing too much. The women doing too much, right? But really and truly, when you start to have this depletion in hormones, and you start in the perimenopause, then your desire to have sex kind of starts to go down. And of course, when you get into menopause, it's like Nobody, sex, what is that, right? Nobody is trying to do that. So, but really and truly, women and getting these hormones balanced, they are having a really good sex life. And so I push women to get those hormones balanced. And not just, I talk a lot about the sex life because women do want to have sex and don't know how to get back to where they were when they were younger. But
Hmm.
also when you're in this menopause, myself and one of the doctors did research on your increased rate of cardiovascular disease when you don't treat your menopausal symptoms, right? And you know that you're irritable and you know that you're not sleeping well and you start to have joint problems, your arthritis is more prevalent. So it's important that you go to the doctor. Yeah, you go to the doctor and you have to really tell the doctor, I want my estrogen and I want my testosterone and my progesterone levels checked. And if you don't have a doctor who is focusing on that, I do doctor referrals. You can reach out to me and I can refer you to a doctor that will help you get balance. And because once you get balance, you're going to be mad that you wasn't balanced for a while because you're going to feel like a brand new person. Like really and truly, that's something that I promise to men and women if they get these hormone balance that they will start to feel better.
Think just in the conversations that I've had with women around my age and just on social media, because you hear a lot more people talking about perimenopause, especially since Tabitha Brown started talking about it. It's like everybody's talking about perimenopause now. You are young, but
That's right.
when it starts, it is jarring, the symptoms, especially when the symptoms come down on you, because I feel like I have every perimenopause symptom that ever existed. My joints ache so badly sometimes. It's crazy. I'm like, oh my God, the hot flashes, I'm sweating everywhere I go, sweat my makeup off. And so it can be like, oh my goodness, what is wrong with me? Because it comes at you fast. And I know a lot of women are wondering what is happening to their bodies and it's perimenopause. And so they really need to go and have a conversation with their doctor. Even me, I am exploring other physicians because I don't feel like, even though I have a female doctor who is a Black female, I still do not feel like she is really invested in the process of helping me really figure out how. She's not walking with me through this process and going through the trial and error period to make sure that my hormones are balanced and my quality of life is back to the standard that I'm used to it being. So,
Yeah, so doctors, they'll tell you, because I remember I partnered with them. In medical school, they probably spent one chapter talking about menopause, right? I had a conference called Menopause What Your Mom Didn't Tell You. Well, your mom didn't tell you because she didn't know to tell you. What your mom told you about is that you're going to start this cycle. You need to make sure you don't have a baby and get pregnant, right? And
mhm,
then
mhm.
they're out. You're gonna have this cycle once a month. Go get your pads, get your tampons. That's what they told us, right? They didn't tell us about menopause. And but frankly, some of us wasn't living to be of age to even get deep into menopause, right? But now we're
Mhm.
living longer, right? And now these symptoms of menopause, like, okay, what do we do with these things, right? And so I always say you don't have to suffer in silence with understanding about menopause. So, menopause was a taboo thing. And again, in medical school, the doctors spend a little amount of a time talking about menopause. And so if your doctor, if she decided that I don't want this, maybe her population of the women that she served is younger. But a lot of my doctors, they grow with their patients, meaning that, their patients, they was in baby state area. Now they're in GYN. And so they're forced because a lot of them are in menopause in that age frame, right? So now they want to help their population be better. And as you said, have a better quality of life. So they've done additional researches and they've done additional things to say, how can we help these women? So there are a lot of doctors, OBGYN for the women, urologists for the men. And I talk a lot about, I know we're talking about women, but a lot of us women have partners. And so it's important. Anytime that I have a platform that I can talk about both to say we both need to get this help, then, I try to do it. So that's why I'm, incorporating the men as well. But
Mhm.
if they talk to the doctor, the doctor will, who actually is vested in how do you have a better quality of life while going through this menopause. If your doctor is not talking about these things, then I have referrals of doctors all over the United States that would help you to manage your menopausal symptoms. But to their defense, they don't talk about it a lot in medical school. And this is not me rumored. I don't hit on the doctors. I partner with them. The medical doctors, I partner with them. We all partner for cohesiveness to make things whole. But this is what they tell me. This is the amount of time that they spend talking about menopause and perimenopause. So when a doctor goes in and really can help you manage your menopausal symptoms and manage your quality of life, that's because they've done research to better understand menopause and how it's affecting Afro-descendant women, right? How it's affecting us. Because remember, things affect us differently because we are different. Our makeup is different. Our mitochondria is different. We're different. So it's important that you get a doctor who understands what are we doing for menopause and how do we help, maneuver. And so that's why I do a lot of conferences, a lot of podcasts to just help educate women and men about, because I told you earlier that we say that the men in menopause is what we say, but they too start to lose testosterone and kind of go through the same symptoms of things that we're having. So it's important to find a doctor that actually helps you with your needs, right? And what you're needing. And again, you can always reach out to me and I can help refer you to a doctor that you're needing to help you in these areas.
A lot of women think that it's normal. A lot of women think, I've heard people say it's normal.
Whenever you smile, I like, what's this question about the okay, go ahead.
It's normal for a woman of a certain age to stop wanting sex. Is that true?
It is not normal for a woman of a certain age to stop wanting sex. If your hormones are depleted, then you just don't want sex then because your hormones are depleted. It is not normal. That's the answer. It's not normal.
So okay.
I kind of went into detail.
I just want you to debunk that myth because a lot of women think that, once they get a certain age and things start to go down, that's just like, well, that's just what happens.
Yeah. Unfortunately,
but, we do have the women who want to be grandmas. We don't want to be at the nursing home catching STIs, but we do want to be at the nursing home, having a good
time. Yeah. Or in your home or wherever you are having a good time.
Somewhere still having a good time. Yes. All right.
I try to tell women.
No, go ahead.
I was going to say, I try to tell women all the time, but I promise you, they reach out to me via email, they call me, and they text me, they reach out to me on social media and just say how I've changed their lives. Like I just thought I was done with this, right? And how their lives have changed. And so because this is my passion, I'm always very excited to just, help educate someone on, but you don't have to have this life, right? You can still have the sex life that you had when you were younger and you were, you had these high levels of estrogen in your body, right? You can have those things again. And again, as we talk about mental health, it helps. We know that it is proven, research-based, that sex helps to settle you down and calm you down. Of course, in an environment where it's both persons are on the same page that this is what we want to do, of course. So we want to throw that caveat in, but
yes,
it'll help you feel better.
Yes. All right, that's a great segue. That's where I was going. You took me there. So, the Capeless Collective podcast is all about the health and wellness of women. We focus primarily on mental health and wellness, but because there's that link between your physical health and your mental health. So talk about the importance of physical health and how it can impact your mental health.
Absolutely. I said I start my day off with yoga. I'm intentional about feeling good, managing my stress. And so I start my days off with yoga. And so when things come at me during the day, then I'm more equipped to say, oh, okay, right. Because I'm relaxed. I've done my yoga and incorporating the yoga is a bit meditation. So I'm more equipped. When you move, here's the thing. When you move, whether it's walking, whether it's yoga, whether it's dancing, I love that everybody is line dancing. That is a public health educators love for me right now, because what that says is that you moving and you got to learn all these different dances and you moving. So I love that there's a trend, if you will, of all these line dances, man, because we've always, as a community, Afro descendants done line dances, but now this is a big thing. I personally love it because you're moving. So what movement does is keeps your cells moving. And when your cells move properly, you get oxygen like you need it. And when you get oxygen in your body that like you need, you sleep better, you rest better, you're calmer, right? With stress. So movement is very, very, very important. And I know, now here's the thing, what I get. Women say, well, I don't feel like it. Well, you don't feel like it because your hormones are not balanced. That's why you don't feel like it. Once you get those hormone balance, you're going to want to go to the gym. You're going to want to get up and move. You're going to want to do something, right? But you also have to be intentional about it, right? I want to move. I want to do this. And if you're not feeling like you want to move in some kind of way, you need to reach out to your doctor with that as well. Because a lot of times women are depressed with their stress, and, and they're just in spaces that they don't want to move around in, and they become depressed, and they, they don't have their blinds up. And I'm from Mississippi. The first thing I do when I wake up is let my blinds up, right? Because that's what my grandmother did, and that's what my mom did, and that's what I do, and let the sunshine in, right? So movement is very important because it keeps those cells, those red blood cells, moving inside of your body so that oxygen can flow free up through the cells to get to your brain to help you feel happier. And dancing and singing and all those things is going to help you to say, I'm going to want to move. But it's a real true thing if you just feel like I can't do it. Your hormones are probably not balanced, and you need to get those balanced so you want to do it. So I don't want to negate that and say it's easy to say, I'm going to do it, I'm going to be intentional. And you can be intentional all day, but if you don't have if you have some imbalances in your body, you're not going to do it because you just have some imbalances that need to get balanced. So that's why you got to get those physicals and those annuals to see where your levels are, your hormone levels are, where your blood pressure levels are, where your diabetes levels are, so that you can know what everything looks good. Now I'm just not moving because I'm just not moving, right? So that's the importance of knowing your stats. But moving is extremely important because I tell people we're the highest form of animals, right? We're the highest form. We can talk, we can write, we can do all these things. But what's important for animals is that we move. We move, right? And so moving is very important. Again, getting that partner, that accountability partner, is very important when you're on this journey for health and wellness. There's no need in you trying to do it on your own. And I know some people are okay with doing it on their own. And now when you get older, you may be like, oh, I can do it. But when you're younger, you may need an accountability partner, right? And sometimes older people do as well. We need accountability partner. And so we need somebody to say, hey, I'm going to the gym. You want to go? I'm going walking. You want to go? I'm going to play. I just asked a line sister today, you want to go play tennis today? And then I said, oh, you can't proceed. You can't go play tennis. So whatever you need to do to keep moving, do it. It's extremely important for your mental health as well as your physical. And when we're talking about your mental and physical health, everything is connected from the top of your head to the bottom of your feet, right? Everything is connected. And so movement helps, remember that oxygen move those cells around more freer, which helps you in all things and balance.
A last question. What type of, or who would you recommend that a woman include in her support system, or what should her support system look like if she has recently been diagnosed with an illness or a disease or something?
Yeah, I would say the first thing that you should do is get in a support group of someone who has experienced what you've experienced, who've gone through the process and have advice. I can say a lot of things, but I've never had breast cancer. I've never had any type of cancer. So I don't try and tell women, oh, this is what you need. I try to direct them to someone who has gone through it, and they appreciate that coming from someone who has gone through it. They're going to have a different level of empathy and sympathy because they've gone through it, right? So it's important that you connect with someone, with a support group who has gone through the same thing that, you have gone through, to learn how to manage, to learn how they felt when they was going through it, to help you to balance some of that fear of the unknown that you have. So I would say the first thing that you should do is to connect with the support group. And again, if you don't want to find one, you can reach out to me. I can help you maneuver that process of finding a support group. But that is very important to find someone who has gone. And I partner sometimes I partner. If someone calls me and say they're going through breast cancer, and they tell me their age, I partner with someone around their age, and just even let that person be their accountability partner, just there for support. And sometimes people don't like support groups; they just want one-on-one. So I kind of just talk to people about what is it that you need, right? What are you comfortable with? How do you maneuver things? And then from that, I connect them with the person that they needed to be connected with based on their needs of what they're needing to do.
Okay. So this has been educational, and we have talked through some fears. We have given you all some pointers. Dr. Burks has told us those things that plague us as Black women. She's told us some things that we can do to make sure that we are, even if those things are hereditary, things that we can do to be proactive to try and avoid them. We talked about how to maybe explore having more pleasurable sex. So we've talked about a lot of stuff. So this has been a really good episode. Take the advice and put it into action. Don't just listen to this conversation and get a giggle, but actually take action, because the information that she shared could really be used to save someone's life. So, while it was fun and entertaining, if you really apply this stuff, it could save you or somebody else's that you love, one of your loved ones' lives. So like she talks about, have a partner, but don't just hear this information, but actually take it, apply it, and take action. So
yeah,
Dr. Burks, thank you.
I also want to tell people how to get in contact with me. I'm Black.
Please do.
I'm Black Pink, the color Black, BLACK, the color Pink, PINK, on all podcasts, on all social media platforms. And so it's Black Pink ORG. So it's Black, the color Pink ORG on all social media. That is also my website, blackpink.org. You can reach me. If you want to email me, I'm at info, INFO, at blackpink.org. But if you don't remember that, you can always go to my website, blackpink.org, and find it. My podcast is the Rhythm Notes of Health podcast. It's on all podcast streaming network. If you want to see it and not hear it, because some people like seeing it, you can go to my YouTube channel, which is also Blackpink.org, and you'll see all of the podcasts. I have them grouped up. I have men podcasts, and then I have some women, and then I have some that talks about vitamin D, talks about magnesium. So myself and the doctors, we go into these things in details. Please tell the people about the podcast, because I do them just for you. And then if you want to know which magnesium that you need, I have them on my website as well as my social media. It'll tell you all the specific magnesiums, and it'll say you take this kind you take citrate for this, you take oxide for this. So it tells you all the different types of magnesium and which one you need for whatever specifically is going on in your body. And I've enjoyed being on here.
Wait. I need you to do one more thing. Talk about the services you provide as well, because you mentioned doing consultations. So talk about your services as well.
Yeah. So I do consultation, especially when the menopause, for the men and the women. You can call me. I can talk to you about your blood work. I do referrals for you. We talked about referrals for the doctors. We talked about referrals for groups that you need to go into based on the dis-ease that you have going on. I do a lot of health and wellness conferences. I do a lot of panels for men and women at churches, wherever I need to go to get the message to Afro descendants or Black people. I go to get that information out to them. You just have to, reach out to me. I have a booking on my website if you need be. I love what I'm doing. This is my passion, and I'm here so I'm gonna live to be 102. So how many of y'all gonna be there with me? And I only say 102 because most of my friends gonna be gone, and then it's gonna be like my daughter, my grandkids gonna be getting on their nerves. I might as well go on. So that's why I said 102, and everything needs to be an even number for me, right?
And so 2 is so random.
Yeah, 2 is because it has to be an even number. So that's
gotcha.
The 2. I normally say 8, but that's gonna be pushing it, so I'm gonna stay at 102, right? And then just make one thing a week healthy choices. And when you eat those salads, don't be having no ranch dressing. If you can't see through the dressing, it's not good. Get a salad dressing that you can see through. Okay? Yeah, because I have people that I do ranch and I do no. If you can't see through them, they're probably filled with just sugar. Of that you do. And I also should say that I do a smoothie in the morning. I don't have no fancy juice machine. I just use my bullet. I do the same smoothie every day. Strawberry, blueberry, banana. I put either lemon juice in there, or lime juice in there. And I juice that. And that's what I have every day. I sometimes have a fruit in the day and then I eat my one meal. So I am intentional because I need to make to 102. So I'm intentional about getting to 102. So just be intentional about your health. And if you do have questions, reach out to me. If I don't know the answer, I'll reach out and get the answer to you and get back to you for the answers.
All right. We have our marching orders, ladies. So I hope that you all have enjoyed this podcast. As I said before, our physical health is so important. If you are sick and tired, it's going to be hard for you to have a good quality of life. It's going to be hard for you to go out and engage with your family and friends and do all the things that you want to do. And while, yes, I emphasize rest and it's very important, but if all you're doing is laying down all the time and laying around and you have no energy to get up and go and experience life, then, there's a such thing as too much rest. So again, take action. Of course, I am going to share my information. It'll pop up here. And I will also drop in a link so that you can access one of Dr. Burks's videos. So it'll take you to her page and become a subscriber. Subscribe to both of us, the Capeless Collective and to Dr. Burks, just so you can continue to learn about your mental health and wellness as well as your physical health. So that's it for us. Remember, rest up, capes off, and you all have an amazing day. Bye.
Bye.